honest, like doing this like around 6 years, but the recovery house been open for 4.5 years. It was because at the beginning I used to do overnight nurse, used to do the overnight assistant at the clinic, and I was seeing a lot of gaps that, you know, the patients was telling me a lot of stuff. And the language barrier, since me and my husband are bilingual and we love people, we decided to open a recovery house. It's very, very important because when you come here, especially the people that come here are from different countries. So after you get released at the clinic in 24 hours, so you really need people around you to make sure you getting the medication, how to clean you, put the faja. It's a lot of things that you can do by yourself. And if you have somebody with you that doesn't know either, it's like the same. You need to be with people around that can help you. Yes, first you need to, your business has to be legit, like you have to go through the process and the Department of Health. That's the number one. You need to have the requirements to be operating. Okay, we have hospital beds and regular beds because for the people that have tummy tuck and breast, it's better to be in a hospital bed so it's easier for them to move and also for the nurse to help them.
That is a requirement.
Yes, it's very important. They require all the beds to be a hospital bed, but since we have a lot of people that only do lipo and BBL, they need to be on the stomach, so regular beds are best for them. Okay, everything that has to do with the aftercare, like massages, a lot of service, because we have a lot of people that come here, like we have dermatologists, we have the spa that they also do facial, different things. We work it in different things, but right now what we have is like basically the needs, like the massages, and to have people here certified that, you know, they know what they're doing and follow the instructions. Only post-care, not only plastic surgery. We have people that comes here that have dental work. We have people that have different type of procedures, you know. No, I usually work with the doctors that are certified. They work with the associations. Yes, only with those doctors. I have people from the island that live out of the city, and they stay here for not as longer as the people that come from other states, but they stay here for 5, 7, 10 days. They stay here as a guest, they receive the same benefits, only, you know, they don't need the nurse. It's not the same as the patient, it's something less because, as I said, they don't need the nurse. We keep in contact, like my nurses keep in contact with the doctor all the time or doctor assistant. So if anything is happening, we communicate with them, and the next step is take them to the clinic. Yes, I have a massage therapist. She's qualified. We have doctors, nurses, and helpers. We check everything because we need to make sure that the paper that they bring here is the truth, and also we need to check all the past from those people because they're dealing with people from everywhere. Sorry. We offer transportation by pick up and drop off from the airport and medical appointments. We make sure when they come back from the clinic to know when is the next appointment, date and time, so the driver know at what time they have to pick them up and take them there. That's one of the stronger things with us because, you know, the safety, that's how they get to us, because they need somebody to trust and somebody that's going to keep them safe. So we have, cameras, we have alarm, and we also have people here all the time. We have somebody at nighttime that can be around, just make sure everything is okay. And for the privacy too, we also have in the room something like, sometimes you'll be in a triple room, but you don't want the next person to see when they, cleaning you up and stuff. So we have that. That's one of the requirements for the Department of Health. All the patient has one of these. This is the call button. When they need help, they press here, and the nurse will know which bed, which person need help at that moment.
Mis responsabilidades como enfermera en Kindness Recovery Home son cuando la paciente llega de la clínica, recibirla, según la prescripción médica que le da su médico. Aquí le formamos lo que es un récord, tenemos el control de todos los medicamentos, la frecuencia, a qué hora le toca, la dosis y todo eso. Ayudar a la paciente con su aseo personal, ya que ella, como es postquirúrgica, no puede hacerlo por ella misma y yo me encargo de eso. También de prepararla cuando ella tiene su cita, avisarle para prepararla con tiempo, para cuando el chofer venga a recogerla y esté lista. Alrededor, aproximadamente un año. Me encanta.
Trabajo los fines de semana, trabajo en coordinación con la doctora Sandra Castillo. Me encargo de informar cualquier novedad que se presente durante mi servicio y también presto asistencia a las enfermeras. Es importante que las pacientes vengan con sus analíticas realizadas, que tengan conciencia de sus niveles hemáticos, de sus pruebas generales, tales como niveles de glicemia, colesterol, en caso de ser pacientes con condiciones especiales como diabetes o hipertensión. Estas patologías no deben ser escondidas al doctor, al médico cirujano. También deben de estar preparadas porque vienen a un país con una cultura diferente, un idioma diferente, que a veces un poco se dificulta la comunicación. Deben tener un poco de paciencia para poder sobrellevar lo que es el proceso de cirugía, ya que estamos claros de que es un proceso estético, pero no deja de ser una cirugía, por lo tanto es un proceso traumático que luego conlleva un nivel de tolerancia frente al dolor y al estrés que supone dicha cirugía. Claro, me encanta lo que hago.
Bueno, mi función es darle los masajes a la paciente después que el doctor les indica los masajes. Bueno, a través del masaje se le ayudan a drenar los líquidos, que por el proceso de la cirugía la paciente puede acumular líquido. Me fascina, vivo mi trabajo.
Trabajar en la alimentación del paciente. Cuando el paciente viene de cirugía, su médico le da una indicación de los alimentos que tienen que comer, alimentos saludables, y aquí nosotros se lo preparamos. Se da el caso de que ellos no quieren a veces esa comida que el médico le indica y quieren su comida de su país. Yo se la cocino, pero baja en grasa, baja en sal y comida saludable. Sí, se le pregunta al paciente. Primeramente yo le pregunto al paciente de qué usted sufre. Si algo le da alergia, me dicen yo no como marisco, como pollo, no como res, y siempre ellos nos dicen qué clase de comida ellos quieren. Sí, me encanta trabajar en la cocina. Me gusta mucho, ellos le encantan, se llevan recetas que yo le hago para su país y siempre están felices conmigo y aquí tengo poca queja en eso.
I am here from the United States, Las Vegas, Nevada. I came to the Dominican Republic to get lipo and Brazilian butt lift. I am staying at the Kindness RH. Was actually referred by other clients that have stayed here on realself.com. And my experience here has been excellent, actually. I would recommend it to my family and friends. Very caring and nurturing staff, very attentive, very clean, and I'm pleased. I would say excellent, very comfortable.
Her website is Kindness RH. Most of the people, they refer from other people, yeah.